Sight Sciences has engaged with early adopters of standalone MIGS to understand the process they went through during implementation and patient education. What key messages do you want patients to know about the surgery itself?
So some patients, when they hear the word surgery, certainly will become a little bit more apprehensive. I think there is a little bit of a dichotomy. There are some patients who are relieved to hear that there's something that can be done surgically, because there is a little sense of like technology and, this is a more direct answer versus when we talk about medical treatments. Many of our patients have gone through medical treatments for a long time, including lasers as well. So when they hear surgery, there's that two-sided reaction where some are relieved, certainly to hear that there is this new option. And then there are some who do feel a sense of apprehension that why do I need that? Is there something that isn't working?
Patients have a lot of trust in us when we're rendering care on glaucoma. So in regards to standalone MIGS, patients have truly embraced it. Of course, initially they think, well, I don't want a 1-hour operation. And we explain to them that this is a glaucoma procedure. However, it's done very efficiently within a matter of minutes with great outcomes and the goal of helping reduce the pressure. People are very much attracted to that. And there's a huge trust factor.
How do you discuss benefits associated with standalone MIGS?
When I bring up standalone MIGS to my patients, I make sure that they understand that they are getting a procedure that's going to increase their chance of having more controlled pressure compared to taking drops regularly. Because there may be patients who are not taking their drops 1 out of the 7 days, and to them, they may not feel like it's a big deal, but that 1 out of the 7 days can slowly over time impact their glaucoma and cause it to become more progressive and more advanced.
Being able to offer standalone MIGS surgery really empowers us as physicians because it allows us to be a more integral part of the patient's journey as far as guiding them and helping them achieve their target. A lot of patients, when they leave being told that, okay, we're not at target, you have to add medications, here's one more thing you have to do. Whereas I think sometimes there is a sense of relief when we can offer, or at least have an option of something surgical or something invasive where they feel like, all right, my doctor is helping me in this position and it's not just up to me. Because many patients don't feel empowered to kind of burden us with their troubles or with how they see their adversity in managing their disease. And when we're able to give an invasive or surgical option, suddenly we are partners again.
Are there any advantages in addressing multiple points of resistance early in the glaucoma disease process?
So for mild to moderate glaucoma, we do know for a fact that people progress with the disease, and oftentimes they have obstruction and they have herniations in the canal. So for us to use standalone OMNI to help reduce those areas of resistance, those 3 points of resistance, have been really, really effective.
Why is the potential to reduce medication burden so meaningful?
There's not one patient who has glaucoma who wants it. And for us, as good doctors, as good eye care professionals and surgeons, it's really incumbent upon us to offer innovation that occurs in the market, finding the unmet need and applying the intervention to the unmet need to help solve it. So there's a trust factor. Patients will continue to talk to us throughout the year, what's new, what's not, and so forth. That said, to only have patients on drops, I think is a mistake. That is a huge unmet need in itself. Polypharmacy is an issue, cost can be an issue, and the ocular surface. So it's very important for all of us in the community to embrace interventional glaucoma, to embrace standalone MIGS. In our case, we love using the OMNI system, which really encompasses both a canaloplasty as well as a trabeculotomy, and addressing the points of resistance.